This video aims to describe 3 different techniques to peel diabetic flat membranes. Flat membranes are ones which do not have any plane of dissection. Creating the plane in such cases is a challenge. In first case, plane was created by lifting membranes from the disc using a pick needle. Here vitreous got detached, beyond arcade. Membranes were then eaten up by 25 Gus 10,000 cutter, which provided great control and allowed me to reach very close to retina while cutting membranes. The bevel tip of cutter further allowed me to reach close to retina and eat away all the adhesions. This technique can be used only where membranes are not strongly adhered to retina. Strongly adhered membranes were managed by segmentation technique. Bleeders were cauterized. Surgery was concluded by completing base shaving and endolaser. This technique is safe as compared to finding plane from periphery. On lifting membranes from the disc, we reach the exact plane without having risk of missing second membrane, thereby making dissection very easy. Second case was initiated similarly, from disc for creating a plane, using a forceps. Contrary to the last case, membranes here were strongly adhered, so they could not be lifted, to be eaten by a cutter. To deal such scenario, the cutter was used to segment the membranes, making use of plane, which I got from the first lift from the disc. Then using vacuum of a cutter, the membranes are held and peeled to the retina, by pulling along the retina not anterior-posteriorly. This technique is safe, quick, and as membranes are totally removed, there is very little risk of bleeding. The only point I would like to highlight here is, the plane of dissection should be accurate, to prevent any iatrogenic tear. Similarly, nasal membranes were tackled. The pull should be very controlled. The densely adhered membranes were removed using segmentation. All hemorrhages were removed and retina was lasered. This case is little different. Here I encountered peripheral flat membranes, with no plane. To deal with this I used a pick to create a plane, which generally lies between 2 blood vessels. Once membrane is lifted, then continue pulling it all around the center of membrane, which is most strongly adhered, to remove it in the end. This technique causes least traction over retina, cause no bleeding as there is no residual fibrous tags. Membrane peeling is one of the most difficult surgeries in retina. Often there is debate whether to initiate peeling from center or periphery. The main point I want to highlight from this video is the importance of correct plane, and lifting membrane from disc provides the most accurate plane. If it's not possible, then plane lies in between 2 major vessels and pick needle is safest tool to get the plane. Thank you.